Trying to quit alcohol on your own? That decision might feel brave, but it can also be dangerous, even life-threatening. The good news? You can detox from alcohol safely and comfortably under medical supervision. Let's walk through what to expect during alcohol detox, why it matters, and how to do it the safe way. Alcohol detox is the first and most crucial step in overcoming alcohol addiction and withdrawal. When someone who depends on alcohol stops drinking, their body can react quickly, and sometimes severely. Withdrawal symptoms may start off mild, but they can become life-threatening fast. Understanding what happens during detox, how long withdrawal lasts, and what treatment options are available can make all the difference. So let's break it down. What happens during alcohol withdrawal? Alcohol is a depressant. Over time, your brain compensates by increasing excitatory chemicals to stay alert. When alcohol is suddenly removed, that balance crashes. The result? Withdrawal. You might experience symptoms like tremors, anxiety, nausea, insomnia, sweating hallucinations, and in severe cases, seizures. Withdrawal can become deadly without medical help. That's why detox should always be monitored by professionals. Why does withdrawal happen? Alcohol slows down your central nervous system. Over time, your body works harder to stay alert and balanced. Take alcohol away suddenly, and the system goes into hyperdrive, causing both physical and psychological distress. Let's go over a typical alcohol withdrawal timeline. Detox length varies, but symptoms tend to follow a rough pattern. 6 to 12 hours after your last drink. Mild symptoms like nausea, tremors, and anxiety, 12 to 24 hours. Anxiety intensifies, with possible hallucinations. 24 to 48 hours. Highest risk of seizures. 48 to 72 hours. Risk of delirium tremens, or DTs. Days 4 to 7. Symptoms ease, but cravings and anxiety can continue. Some people also experience post-acute withdrawal symptoms, or PAWS. These include sleep problems, mood swings, and cravings that can last for weeks or even months. Is alcohol detox at home safe? Detoxing at home can be extremely dangerous. Without medical supervision, symptoms like seizures and DTs can lead to hospitalization, or worse. That's why working with a trained detox team is so important. Treatment options: inpatient versus outpatient detox. Inpatient detox provides 24/7 care in a controlled environment. It's ideal for those with moderate to severe addiction. Outpatient detox is less intensive. You live at home but visit a clinic daily for treatment. This option only works if you have mild symptoms and strong social support. Not sure which one is right for you? Talk to a licensed treatment provider. Now let's go over the medications that support detox. Doctors may recommend medications to manage withdrawal and reduce cravings. Common options include benzodiazepines for anxiety and seizure prevention. Naltrexone reduces cravings and blocks the buzz. Acamprosate supports long-term sobriety. Disulfiram creates negative reactions to alcohol. Thiamine and B vitamins help prevent brain damage caused by alcohol-related deficiencies. Other medications like gabapentin, ondansetron, or hydroxyzine may also be used based on your symptoms. These medications work best when prescribed by a doctor as part of a full treatment plan. Let's talk about why going cold turkey can be so dangerous. Going cold turkey sounds simple, but it's not. Up to 5% of people going through alcohol withdrawal develop delirium tremens, or DTs, and DTs can be fatal in as many as 4% of cases. Don't take that risk. Medical detox is the safer option. Holistic and long-term support for recovery doesn't stop at detox. A well-rounded, holistic approach can help you stay sober for the long haul. Start with the basics. Eat healthy. Stay hydrated. Get enough sleep. From there, explore treatments like behavioral therapy, including CBT and DBT peer support, like 12-step meetings or group therapy wellness practices, yoga, fitness, meditation, and mindfulness. These approaches build mental strength and provide tools for handling stress and cravings. But detox is just the beginning. What happens after that, how you care for your body and mind, is just as important for long-term recovery. If you want to use professionals to help you stay sober during the hardest moments, here is what you should consider when choosing an alcohol detox program: the severity of your addiction, your overall health, and any existing medical issues, whether you need care for co-occurring mental health conditions, insurance coverage, and whether you'd feel more comfortable in a local, luxury, or specialized setting. Ask questions like, is detox medically supervised? Do they offer medication-assisted treatment? Can they help transition you into ongoing care? Do they provide holistic support? Here are a few of the most important questions regarding detoxing from alcohol. What is alcohol detox? It's the process of removing alcohol from your system while managing withdrawal symptoms under medical supervision. How long does alcohol withdrawal last? Most symptoms begin within 6 to 12 hours of your last drink and resolve in about a week, but post-acute symptoms can last longer. Can I detox from alcohol at home? It's not recommended. Home detox is risky and can be life-threatening without medical help. What medications help with alcohol detox? Your doctor might prescribe benzodiazepines, naltrexone, acamprosate, or other medications depending on your needs. Is outpatient detox effective? Yes, for people with mild to moderate addiction and a strong support system. Always consult a medical provider first.